Hello, I'm Dr. Balanle Akinranbe, psychiatrist and founder at Bright Minds MD in New Jersey, where we help people with depression, anxiety, and other mental health disorders feel better using fewer medications and wellness practices. Okay, so I had a patient who told me that they've really been afraid to see a psychiatrist because they're afraid that the psychiatrist will just throw medicines at them, and maybe before they know it, they will be zombied out. Some of my patients have this fear given some of the medication regimens that I've seen come across when I've worked with some patients. So I'm not surprised the general public is fearful of seeing psychiatrists. The goal of the psychiatrist is not to change your personality or get you zombied out, but to get you the right combination or the right monotherapy or the right medication that would help improve your condition when medications have to be used. And in medicine, there is something called shared decision making. And typically, when you're seeing a psychiatrist who is competent or skilled and good at what they do, ideally, after discussing your problems, looking at psychosocial contributors, ruling out other medical concerns, and once it's decided together that medications would be the right path for you, ideally, in a shared decision model, your doctor should discuss all the treatment options with you. And this is not just in psychiatry, but in general, but especially for psychiatry, we would discuss all treatment options, which would include medication options, non medication options, interventional options, and even non treatment as a choice. We would discuss the pros and cons or risks and benefits of each treatment. If we're discussing medications, I would discuss a variety that may be appropriate. We'll talk about potential side effects. We'll talk about benefits of treatment, things to watch out for, what to do about them to help you feel confident in decision. And then together, once we discuss these things, most of my patients feel pretty confident making the decision one way or another. Sometimes some of my patients ask for some time to think about medication treatment, which is something a lot of people feel fearful of. Sometimes we have this conversation in our first visit. Depending on how acute or how serious things are in the moment or comfort of my patients, they would ask to go home and think about it for a little bit, and we'll schedule a follow-up appointment within a week to ask more questions and then make up their minds about how they want to proceed with treatment, which of the medicines I've talked with them about that they feel comfortable with. Once we've made these decisions together, we'll write the script, remind people of side effects to watch for, and follow up within 2 to 3 weeks to really reevaluate, see whether the initial dosing is working, and then to decide whether that dose is appropriate. Oftentimes in psychiatry, we start medications on a low dose to test for tolerability and side effects before we bring up the doses to the amounts appropriate to treat or get clinical efficacy. Thank you for listening. Don't forget to share this with a friend or two. Until next time, it's Dr. Bolanle on the Bright Minds MD and your mental health. Ciao.